So, good evening session of Cancer Care at American Oncology Institute. And today we have with us Dr. Anbu Chandrasekhar, Consultant Radiation Oncologist, American Oncology Institute at Royal Care Hospital. He did his undergraduate from the prestigious Madras Medical College and his PG in Postgraduate Institute of Medical Sciences, Rohtak. So, Dr. Anbu holds an overall experience of 8 years in the field of radiation oncology. So, in today's topic, we are going to discuss about SRS, an advanced radiation treatment for brain cancers. So, over to you, doctor, and a warm welcome.
Thank you, Ms. Vaishnavi. Thank you for having me here. Good evening to all. SRS means stereotactic radio surgery. This is not a surgical technique, it is a radiation therapy technique where we use high energy X-rays and gamma rays for the treatment of the disease. SRS is mainly used for treating intracranial lesions with a very high dose of radiation, and it is delivered in a single session. For example, for comparison, in the conventionally fractionated radiation therapy, we use a radiation dose of 2 gray per day for the treatment of the patient. But with SRS treatment, we will deliver a dose of about more than 10 gray per day in a single session. So this is called as a radio surgery. First of all, because this term is coined by the Swedish neurosurgeon, so that could be one reason. Another reason is this technique is similar to surgery in a way, like this treatment is completed in a single day, similar to surgery, and the main aim of the treatment is the complete ablation of the lesion, like surgery. So it is called as stereotactic radio surgery.
How does SRS differ from other forms of radiation?
So other forms of radiation means the radiation techniques that we commonly use day to day in our radiation department, like techniques like 3D conformal radiation therapy, IMRT treatment, VMAT treatment. So the first major difference between SRS and other forms of radiation is the usage of very high dose of radiation. So in order to deliver a very high dose of radiation in a single session, the radiation therapy treatment should be very precise and accurate in each and every step. Right from the rigid immobilization of the patient by using invasive frames or by using double layered thermoplastic masks, then by using simulation CT with very thin slices of thickness, very thin slices of thickness. For example, for IMRT treatment, we use a slice thickness of 3 millimeters, but for SRS treatment, we use a sub-millimeter slice thickness, to be precise 0.625 millimeters. Then by using cone beam radiation therapy, cone beam CT scans, on-couch cone beam CT scans, for the precise positioning of the patient and verification of the position of the patient during treatment. Then by using high definition micro MLCs, which have a leaf thickness of about 2.5 millimeters when compared to the conventional treatment where we use MLCs with thickness of 1 centimeter. Like this, the treatment of SRS is delivered by using accurate procedures in each and every steps of radiation.
So, what is the duration of a patient to undergo the treatment?
So usually SRS treatment is delivered in a single day, but sometimes the stereotactic radiation can also be delivered in 2 to 5 fraction, that is in 2 to 5 days, especially when the tumor lesion is more than 4 centimeters in size, or when the tumor is located very close to critical normal structures where it is very difficult to irradiate the patient in a single session. In those scenarios, we will use a fractionated stereotactic radiation, and this treatment will be delivered in 2 to 5 days.
So, how does gamma knife different from LINAC SRS?
So gamma knife is the first machine, dedicated radiosurgery machine, which is developed for the treatment of SRS. So in gamma knife, it will be having 201 cobalt sources, and these sources irradiate beams, and these beams are collimated into a single point, so that at that point the radiation dose delivered will be very high. But in linear accelerator based stereotactic radiosurgery, there is no sources, no radioactive sources there in LINAC, where we will use linear accelerator to accelerate electrons to very high energy and make them to hit a tungsten target, and then the X-rays are produced, and these high energy X-rays are used for the treatment of the patient. In gamma knife, the immobilization of the patient requires an invasive stereotactic frame. But in SRS LINAC, non-invasive methods can be used for immobilization of the patient. As well as gamma knife can be used only for the treatment of intracranial lesions, whereas this SRS LINAC can be used for the treatment of intracranial as well as extracranial lesions.
Can you state the clinical conditions where SRS can be highly used?
So the SRS treatment is useful in malignant diseases like brain metastasis, recurrent brain gliomas, in benign diseases like pituitary adenomas, vestibular schwannomas, meningiomas, in functional disorders like trigeminal neuralgia, essential tremors, cluster headaches, OCDs, and in vascular malformations like AV malformations. In all these conditions, SRS is useful.
So is there any specific machines used to deliver this SRS, doctor?
Yes, as I already mentioned, the gamma knife is the dedicated machine for the delivery of SRS treatment, and in 1980s the LINACs were introduced, and the latest advanced LINACs are capable of delivering stereotactic treatment along with the regular radiation therapy techniques. So gamma knife can be used for SRS treatment, advanced LINAC can be used for SRS treatment, as well as proton beam machines, accelerators can also be used for giving SRS treatment.
So doctor, can you describe the role of SRS in trigeminal neuralgia?
Yeah. Trigeminal nerve is the fifth cranial nerve, which gives a sensory supply to the face as well as a motor supply to the mastication muscles. So trigeminal neuralgia is a clinical condition in which the patient experiences a brief episodes of severe recurrent pain in his face. So these conditions is usually managed medically using medicines like carbamazepine, gabapentin, phenytoin. In patients who are not getting relieved with medical management, SRS could be a wonderful option to treat these patients. So patients who are treated with SRS have shown complete pain relief in about 40% of the patient and partial pain relief in about 70% of the patients.
How is SRS useful in brain metastasis?
So brain metastasis is especially useful in the treatment of patients having 1 to 3 brain metastatic lesions. It is used along with whole brain radiation therapy, and SRS is used as a boost technique in order to boost the lesions, gross disease lesions. So usually a dose of 14 to 24 gray is used to deliver to the gross disease lesions, and in some studies it has been proved that patients who received whole brain radiation along with SRS, their median survival has increased to up to 10 months, which is a wonderful achievement in the life of brain metastasis patient.
So what are the key differences from SRS in surgery, doctor?
So surgery, the basic difference is surgery is an invasive procedure where we need to cut the skin of the patient, open the skull of the patient, whereas SRS is a non-invasive technique. As well as surgical treatment requires an anesthetic procedure where the patient has to be fit to receive the anesthesia, whereas SRS treatment doesn't need an anesthesia. Similarly, the post-operative procedures, post-treatment complications are very less in SRS treatment. After completing the procedure, patients who have undergone SRS treatment can go to their routine work and go to their routine job within 1 to 2 days of treatment. That's the basic difference between SRS and surgery.
So, comparing to other treatments, will the procedure will be painful?
SRS treatment, as like any other radiation therapy treatment, is a painless procedure. The patient won't be feeling any pain or discomfort or any warmth.
So, doctor, how SRS is useful in meningioma?
So, meningioma is a benign brain tumor that arises from the meningeal coverings of the brain. So, meningioma is basically treated by surgical excision. But in about 1/3 of patients, the meningioma arises in sites where surgery is inaccessible. So, surgical excision is not possible. In those patients, SRS is a life-saving option for those patients. So, for those patients are treated with a radiation dose of 14 to 24 gray in a single session, and the dose depends upon the size of the lesion. For lesions that are less than 2 centimeters in size, a radiation dose of 24 gray is delivered. For lesions that are 2 to 3 centimeters in size, a radiation dose of 18 gray is delivered, and for lesions 3 to 4 centimeters in size, a radiation dose of 14 gray is delivered. So, studies have shown that in meningioma, after SRS treatment, the tumor control is achieved in about more than 90% of the patients.
When we have a lot of treatment options, is SRS an affordable option?
So, since it is a very sophisticated and a high-end treatment, SRS is pretty expensive, quite expensive. But when compared with neurosurgical treatment procedures and other radiation therapy techniques, SRS is quite a cheap option in comparison. Moving forward, if the hardware and the softwares all will develop, and it will become a relatively cheap option in the future.
So, doctor, what are the side effects that we can expect from this treatment?
So, as like any treatment, no treatment is without any side effects. So, SRS, when in comparison with surgery and with comparison with surgery, it produces less side effects. The side effects that are commonly experienced by the patients are headache and vomiting. So, these happen because of the edema of the brain, and these conditions can be managed using medicines.
So, doctor, finally, what are the facilities available at AOI Coimbatore for SRS treatment?
Yeah. For providing SRS treatment at American Oncology Institute located at Royal Care Hospital, Coimbatore, we are having a state-of-the-art variant rooming STX Linacs. This STX in the name stands for stereotactic treatment. So this machine is specifically designed for stereotactic treatment. So our machine has a high definition micro MLC on couch cone beam CT scan for perfect patient positioning, and it has a couch which is having a 6-degree freedom of movement along with a radiation delivery technique which can deliver the radiation with sub-millimeter accuracy, less than a millimeter accuracy.
Thank you, doctor.
Thank you.
So, thank you, viewers, for watching the live session. Stay tuned and please subscribe to our channels. If you have more queries, please reach out to us through the messenger or post them in the comment sections below. Thank you.
Thank you very much. Thank you for having me.